previous video, we have discussed about varicella or the chickenpox, which is a very popular name, and we have discussed about some points. Now we are going to discuss further. Today we are going to discuss about what happens if this virus occur in a pregnant lady, and what are the complications occur to that woman as well as to the babies. Chickenpox in pregnancy is highly fatal for the babies as well as for the women, and it tends to be highly fatal to a woman or a lady who are in pregnancy with a high risk of pneumonia. In babies, this virus can develop or the complications may develop in two forms. It depends upon the gestation period of a mother and when the chickenpox occur. If the chickenpox, or you can say that if the maternal varicella occurs, if the woman is in the first half of the pregnancy, there are high chances that the baby would escape the symptoms of the disease, and the baby would be asymptomatic. However, in some cases, it is found that the symptoms may develop in a babies, and these we known as fetal varicella syndrome. However, there are some babies who would escape from the symptoms and they are asymptomatic, but they carry varicella zoster virus infection. If the rashes appear weak or more before the delivery, there's a high chances that the maternal antibodies would develop, and that will be transplacentally passes to the baby, and the baby would escape from the symptoms. However, in those cases when the woman develop the rashes within 7 days or within 2 or 3 days, there's a high chances only the virus would pass transplacentally but not the antibodies, and because of that the baby would suffer neonatal varicella, or we can say that the congenital varicella. So that is a very serious problem, in that we have to give immediate support to the baby, and there's a high risk of pneumonia and encephalitis as well. In this, if the baby is suffering from this, we have to give immediately chemotherapy as well as varicella zoster virus antiserum, so that the baby would be stable. However, it is found that the people or the adults as well as elderly who are at a high risk of this disease, because in adults the severity of the infection is very intense, and it cannot be manageable if we delay. So we have to give immediate treatment to the people who are lacking immunity, as well as elderly, as well as those who are suffering from other complications like encephalitis, varicella, pneumonia. And as far as the laboratory diagnosis are concerned, there's a techniques by which we can detect the antigen of this virus by immunofluorescence on the skin lesion, and by ELISA as well as a PCR technique. ELISA means enzyme immunosorbent assay, as well as PCR means a polymerase chain reaction. If you come to the treatment part, we have to give antiviral medication as soon as possible when we detect that this is chickenpox. We have to give two types of medication which are very effective. First is acyclovir and flamciclovir. That is antiviral medication, and that of the people who are suffering from this disease. We have to avoid corticosteroids because that will enhance the risk of pneumonia, because corticosteroids are usually decreases the immune system, and the virus occur because there's a lack of defense system in our body. So that's why that is contraindicated. And I will show you that the name of the medicine which is highly effective in this disease. So you can see here, one is acyclovir and another is flamciclovir, and you can see here on the last steroid that is contraindicated. So this is up to now, and in the next video we will discuss about some other common problem. Till then, thank you and bye bye.